everybody. Happy New Year. I'm Dr. Sunanda Chava. Today I would like to talk about cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is also called mucoviscidosis. So it it is the autoimmune recessively inherited disorder. It runs in families. It affects the gene called transmembrane conductor regulator gene, that is CFTR, transmembrane conductor regulator gene alteration. So the exocrine glands are affected. All the exocrine glands in the body are affected. It affects cells that make mucus, sweat, digestive and reproductive secretions. CFTR gene controls the movement of salt and water in and out of the cell. So this gene alteration causes the thick sticky mucus in saliva, respiratory, digestive and reproductive system, as well as extra salt in the sweat. The thin and slippery secretion produced in normal individuals protect body's intestinal tubes and ducts and make them smooth pathways. In cystic fibrosis, the gene is affected, so the thick and sticky secretions plug up the pathways in lungs, pancreas, intestines, and reproductive system. The result is infections, that is like pneumonia, pancreatitis, and infertility in males and females. The clinical features in respiratory system, the features, signs and symptoms are thick mucus cough, recurrent sinusitis, stuffy nose, cough, wheezing, limited physical activity, repeated lung infection, lung collapse, nasal polyps, and most common cause of death in cystic fibrosis is respiratory failure. So this can happen as a complication, and then there might be recurrent sinusitis also. If the liver is affected, the liver disease and cirrhosis can happen, and then gallstones can occur because of thick secretions, and because the secretions are affected, there might be problem with the absorption of nutrition like fat, protein and all. So this might calcium and all, and this might result in osteoporosis, joint pain, arthritis, muscle pain and all. So the effect in digestive system is enzymes from pancreas to small intestines in the juices, blocked juices are in blocked juices. So there is absorption of nutrients problem. So this might result in malabsorption like proteins, fats and all. So there might be foul smelling greasy stools, poor weight gain and growth, blocked intestines, intussusception, and then constipation, which due to constipation, when there is severe straining while passing the stools, there might be rectal prolapse, and then there might be more salt in the sweat. So when the parents kiss their children, the cystic fibrosis affected children might the sweat might they might notice that the salt in the sweat is more. So there might be infertility in males and females. It's a bit more in males. Then the electrolytes might be out of balance and dehydration can occur, especially when exercise is done and in hot weather. And then GERD, gastroesophageal reflux disease, can happen. And these individuals are prone for cancer because this thick and blocked secretions can result in the carcinogens in the secretions to stay for more long time and are in contact with the mucosa. So they work and then they cause cancer. Newborn screening can be done for the diagnosis. Usually in United States and all, within 1 month of birth they diagnose newborn because they screen for that. And then they say for immunoreactive trypsinogen, IRT, immunoreactive trypsinogen, and then this test is done as newborn screening test, and of course this can be increased in premature birth and stressful deliveries. The sweat test is done to diagnose the cystic fibrosis. It can be done in the baby 2 weeks old. So otherwise also it can be done. A chemical to produce sweat is put on skin and salt content is seen. This is increased in cystic fibrosis. And genetic counseling can be done along with IRT levels for the diagnosis. Management is to ease the symptoms. There is no cure for cystic fibrosis. So you can manage symptomatically. For example, lung if it is blocked, you have to use the tube to clear the secretions from the lung and all. So the goals are preventing and controlling infections, removing and loosening mucus from lung, and then treatment and preventing the intestinal treatment. You have to do it. Treatment you have to treat, and then you have to prevent the intestinal prolapse, intestinal blockage. And the nutritional supplements you can give in undernourished individuals or malnourished individuals. Hygiene maintenance, the people, cystic fibrosis affected people and then people around them and the environment must be clean. So hygiene should be maintained. Medicines like CFTR modulators like elexacaftor, ivacaftor and tazecaftor, more often called as trikafta, can be given. CFTR modulators can be given. So to for treating CFTR gene. Antibiotics to treat and prevent lung infections can be done. Anti-inflammatory drugs to lessen swelling in lungs, and then hypertonic saline to thin the mucus, to cough off the mucus, and then improve the lung infection. Mucolytic agents can be used. Pancreatic enzymes can be used and they can be given in the form of capsules orally to help the absorption of nutrients, and then stool softeners can be used, and then acid reducing medicines can be given, and then these pancreas can be affected and therefore insulin secretion can be affected. This might result in diabetes, and then liver disease can happen. And so these individuals can do physical exercise to clear the secretions. Then dietary counseling can be done, mental health counseling can be done, education about the condition can be done, and then as a last resort, transplants can be used. Lung transplants, liver transplants can be used as a last resort, and as supportive measure even oxygen therapy can be given, and then bowel surgery can be done for intestinal problems. So this is about cystic fibrosis. So happy new year once again all of you. I'll meet you in the next video. If you like this video, please like and subscribe. Thank you very much. Bye.